Hi, this is my second attempt video for skill 113, intubation. So I would gather all my materials as per the online induction tray preparation skill. One of the complications that could happen when we administer the induction drug would be apnea or an allergic reaction to the drug. And one of the complications that could happen during intubation would be laryngospasm, which is why we have our xylocaine spray, and that is common in cats. We'd have our assistant properly restrain the patient in the proper position. To determine the proper endotube length, we would measure from the tip of the nose to the scapula or the thoracic inlet, and to measure the diameter, we would measure against the nasal septum. For dogs, we can calculate it by taking their body weight in pounds, dividing it by 10, and adding 5. We could also use a chart that was provided with the recommended ET tube size. This is our laryngoscope. We'll need to make sure that is working so the light turns on and that we have the appropriate blade size. So to use the laryngoscope, we'd have it in our non-dominant hand. We'd have the tongue grasped with the same hand like so, and we would depress the tongue with the laryngoscope, and that would allow us to see the anatomical structures right here. So we got our epiglottis here, we got our vocal folds, we got our glottis or the larynx, and the arytenoid cartilage, as well as the hard and soft palate above here. Then we would intubate our patient. So we'd have our sterile lube on our ET tube. So pretend this is my ET tube, and we'd be holding it like a pen, and we would depress the epiglottis with the ET tube and properly intubate the patient. After that, we would tie the ET tube over the maxilla for dogs, and for small dogs and cats, we would tie it behind the ears. Then we'd connect our ET tube to our breathing circuit with the oxygen on, and then we would inflate our cuff and confirm the proper placement with manual positive pressure ventilation. So we'd inflate the cuff using a syringe right here at this position, and how we would determine the proper position of the cuff is we would get our assistant to close our pop-off valve here and then let the air fill up the reservoir bag. We'd get our assistant to squeeze the bag for a second and hold it there for a second and then release. And with the breath, we'd put our ear against the patient's mouth and we'd listen for any leaks. And if there isn't any leaks, then that means our cuff has been properly placed, and then we can stop inflating it. And that is how you properly intubate a patient.